Hi, I wanted to spend a few minutes talking about the intersection between chiropractic care and regenerative medicine. I've been a chiropractor for 26 years. I've been very successful. I've helped thousands of people get better from all sorts of conditions: neck pain, low back pain, numbness, tingling, all these issues. The basic concept is this. Now, this is a spinal segment, and as we look at the spinal segment, you'll see that this right here is the vertebra, that right there is the disc, and behind that disc you have the nerve, and the nerve sits right here and it comes out behind the disc. Now, chiropractic's very good if you have this motion segment and it's not moving. It's supposed to move like this, but when it stops moving, then you can get inflammation in the disc and you can start getting pressure on the nerves, and that can cause big problems in your spine. So chiropractors can get in there, and with their hands, they can rehabilitate the discs and the nerve, getting the pressure off the nerve, bringing relief to the spine, getting rid of pain, as well as taking care of radiculopathies, neuropathy, any kind of tingling, numbness, or pain that's shooting into different areas. Now, the problem is sometimes as we age, our body doesn't heal like it used to. When we used to heal, like when we were 18, 19 years old, you remember those days when you used to get hurt, you just seemed to bounce back. Next thing you know, a couple weeks later, you're playing ball or doing your activity. As we age, each year that goes by, we only have about 10% of the previous year's stem cells. So by the time we hit 40, 50 years old, all of a sudden we just don't have the cells that we used to have to heal. So instead of healing and that joint regenerating and healing the way it's supposed to, the joints begin to degenerate. So as time passes, especially in an injured joint, you're going to see a spine that looks more like this. And as we look at this disc is unhealthy. You can see the spurs. You can see that the disc, if we look at the inside of the disc, there's supposed to be a jelly center. Fibers on the side, this jelly center is torn. So you have herniations, you have sequestrations, bulges, different injuries like that. Now, those cases in the past, we handled chiropractically, and in many cases, we were able to get them better, and we were able to get those bones moving again and take the pressure off the nerve, eliminate the symptoms. We really weren't doing a lot with the underlying degeneration. We were just getting it rehabbed to the point where it's functional and non-painful again, which is a great solution. The real advance in our clinic is that when we added the regenerative stem cells to these spines, what we started noticing is that we were getting a much higher percentage of good outcomes, and we were starting to take care of some of the underlying degeneration, rewinding the clock, so to speak, so that you're healing like a young person. Now, if there's already quite a bit of damage, we don't expect that to become a 20-year-old disc, but we are getting amazing results with cases that we weren't able to in the past. So this cutting-edge solution is so nice. And so if you are thinking about going to a chiropractor or you're investigating stem cells, I think the combined approach is so smart. The idea or the illustration that I like to use is, can you imagine if your car has a misaligned tire and you're driving down the road and the tread gets all worn out, right, like the disc? And with the stem cells, what we can do is like putting a new tire on that car. We're able to regenerate new tissue and get the healing process in there. But if you don't do anything about the underlying misalignment, you may end up where you started with that worn out tire. So the combined approach of both alignment and the stem cells has been very powerful for so many people. We've been happy to help them with that. The last 3 years, we've added it into our clinic and we've seen some really tremendous outcomes. So if you're curious about whether or not this would help you, I encourage you to reach out. I'd be happy to sit down with you and we could explore that together.